VRE stands for vancomycin-resistant enterococci. Like MRSA, VRE is an infection that spreads through physical contact, and it's a growing concern because it has become resistant to some forms of treatment. Those at increased risk of VRE include persons in hospitals, especially if they're being treated with antibiotics over an extended period, persons with weakened immune systems, persons recovering from surgery, persons being treated with medical devices such as urinary or IV catheters.
VRE was virtually unknown before 1989, but today it's become a major health problem, especially in hospitals. VRE can live in a person's intestines or female genital tract without causing disease, but sometimes it causes infection of the urinary or intestinal tract or bloodstream. Since VRE is spread by contact with infected stool, urine, or blood, the most important prevention steps are careful hand cleaning and keeping environmental surfaces clean and germ-free.
Norovirus is another example of a serious infection that spreads mainly by contact with contaminated hands, substances, or surfaces. These infections can cause acute onset nausea, vomiting, diarrhea, and abdominal cramps. Headache and a low-grade fever are sometimes symptoms.
Studies also suggest that in about 30% of those infected, there are no symptoms. Noroviruses are highly contagious and can spread as an outbreak within a healthcare facility. Transmission of norovirus infection is caused by contact with contaminated hands, feces or vomit, or water, food, or surfaces that have been contaminated.
If you can, pause the video here to talk about the various types of infection and how they spread. What questions do you have? Are there some risks you haven't been taking as seriously as you should? Knowing about infections is half the battle. Following through as an individual and as part of a team is the other half. We'll look at 6 ways you can take an active role in breaking the chain of infection. Clean hands, following procedures, personal protective equipment, a safe, clean environment, a healthy lifestyle, and teamwork.
Hand washing is the key to infection control. It's important how and when you wash your hands because germs are everywhere in the workplace.
Here's how to wash your hands correctly. Start by pushing your sleeves up and rinsing first in warm water. Hot water is hard on your hands and isn't necessary. Now, spend some time working your hands together. How much time? That depends on the circumstances. What have your hands touched? How soiled are they? But the recommended minimum is normally at least 15 seconds. Get around and under nails and cuticles. Then rinse carefully and dry thoroughly with a paper towel. Finally, turn the faucet off using a clean, dry paper towel. Many people also use that last paper towel to open the restroom door as they leave, and then they dispose of it in the nearest trash can. Additionally, in hand washing, when is just as important as how. And the fact that you washed your hands 5 minutes ago is not as important as what you've done and what you've touched in those 5 minutes. You've got to wash your hands before and after your work shift, before and after giving care to a particular person, between procedures on the same person, before and after eating, drinking, handling foods, and smoking, before and after using the toilet, after covering a cough, blowing your nose, or combing your hair, every time you put on or take off gloves, whenever your hands become obviously dirty, And whenever you have a question, if you wonder, should I wash? The answer is yes.
Alcohol-based hand gels are an important option for keeping hands clean and germ-free. They are not for when your hands are visibly dirty or you know that they're especially contaminated. But other times, the alcohol gels may actually work better than washing with soap and water. And they have some big advantages. They're accessible, don't take much time, and are easier on your skin.
The alcohol gel products are a relatively new innovation in the United States. However, they've been used very successfully for years in Europe. They provide rapid kill and kill a wide variety of organisms. You also can be sanitizing your hands while you're moving in to see a patient without needing to stop at a sink.
To clean your hands with an alcohol gel, follow the product's directions for the amount to use. Then, squirt it on the palm of one hand and rub both hands together, covering all surfaces, including between your fingers, under your nails, and around your cuticles until your hands are dry, usually 15 to 20 seconds. One more thing about germs on your hands. They're harder to get at when you wear rings, chipped or cracked nail polish, or artificial nails. And don't forget to keep your own nails trimmed.
Short, well-trimmed nails are very important. To judge if your nails are too long or not, just put your hands up, and if you can see the tip of your nails past the tip of your fingers, they're too long, and they could scratch patients and they will trap large amounts of bacteria.
Following correct procedures covers a lot of territory, including many specifics your supervisor or instructor will explain. But let's look at some of the basics. For example, healthcare organizations are required to have an exposure control plan and procedures for what to do when an accidental exposure happens. You need to be familiar with these plans and procedures.
And don't forget, we must have this incident report filled out, answering all of those questions that we just talked about.
Healthcare providers are also responsible for implementing what are called standard or barrier precautions. This is a system for putting a barrier between you and any blood or other potentially infectious material. As a healthcare worker, you are also responsible for following correct procedures for handling needles, broken glass, and any other sharp objects. For example, a used syringe is contaminated and must be properly disposed of in an approved container. If the container is hard to reach or almost full, make sure it's repositioned or replaced with an empty container. Never bend, recap, or ignore a used syringe. And never place any sharp object on a tray or bed where it would be a risk to others.
These are just some examples. Every organization gives its own procedures a lot of attention, and you need to learn and follow them. We all try to avoid accidents. That's what precautions are all about. But once in a while, an accident will occur, and when it does, you need to report what happened right away. There are forms of preventive treatment, additional defenses, that must be started within a certain time period. A quick medical response to an accidental exposure to blood or body fluid is essential. It's not a time to cut corners or to hide what happened. Not all situations are clear-cut, so there will be times when you'll need to use your head and good judgment, like following correct procedures for calling in sick when you're sick yourself.
A big part of infection control is using your own good judgment. For example, if you wake up ill in the morning with flu or cold symptoms, make sure you contact your supervisor and possibly see your physician.
Personal protective equipment, things like gloves, masks, eyewear, and gowns, are designed to put a shield or protective barrier between you and sources of infection. In your job, you must know what types of equipment are appropriate for the tasks you perform. And you need to know where this equipment is kept, when and how to use it, and how to dispose of it. Which items you use and when depends on the degree of exposure you're expecting. For example, use a gown, gloves, face, and eye protection when a splash or spray of body fluids could happen. Or you might put on just gloves when you're picking up a small spill. Or you might need gloves with a gown and the cuffs overlapping in giving care to a patient with scabies. Some healthcare workers are allergic to latex gloves. If you are, be sure to let your employer know so a latex substitute can be provided. The order in which you remove and dispose of personal protective equipment is also important. Be sure not to infect yourself or others. Remove the dirtiest items first, usually your gloves and gown. Wash your hands before removing mask, goggles, or respirator so you don't spread germs to your face. Dispose of your protective items in an appropriate container in the location where you use them. Do not carry them away with you. That way, you won't spread germs. And last, when you're done, be sure to clean your hands thoroughly. A clean environment helps protect everybody, and it's everyone's responsibility. Regular housekeeping, as well as special cleanups, need to be handled in a safe, professional way. For example, wear gloves when you handle soiled linen. Watch out for sharp objects that may have been accidentally left in the sheets. And when you're cleaning up a spill of blood or body fluid, if the spill involves broken glass, use tools such as a brush and dustpan to pick up the pieces. Never use your hands. Use an appropriate disinfectant to clean the surface as soon as possible. And remember to clean the tool afterward or dispose of it correctly. Remember that last link in the chain of infection. It's a person with his or her guard down. Personal habits play a big part here. The more you take care of your health, the greater your chance of breaking that link. So be sure to eat right, get enough sleep, get enough exercise, and take advantage of vaccination when your employer and doctor recommend it. All of these steps really start to make sense when you realize that you're part of a team. Everyone's health and safety depends on working together to stop infection from spreading. Here are 3 examples of helping to break the chain of infection through teamwork. Sharing your ideas for better infection control, working together to follow your facility's infection control procedures, always remembering that the extra measures you take will benefit not just you, but also your coworkers, those you help care for, and your family at home.
It's like everybody from maintenance, laundry, housekeeping, CNAs, nursing, we're all like a piece of what I call a pie. And it's important that everybody in that piece pie does the job that they're given to do. Otherwise, it all breaks down. The whole system breaks down.
We've seen that the chain of infection is made up of 6 links every infection needs in order to survive and spread. Break any one of those links and you help to stop the spread of infection. This is serious business and an important responsibility for all of us. When we know about the chain of infection and make prevention a top priority every single day, we're protecting our own health and safety, as well as the health and safety of everyone around us. Thanks for watching.
Does anyone have any questions on any of that? All right, everybody stand up for like 30 seconds. The last thing before lunch here.